Hello and welcome to this video about cell signaling in people with type 2 diabetes. So what is diabetes? Diabetes is the impairment in the way the body uses glucose as a fuel. Diabetes causes too much sugar in the blood, resulting in other disorders. A normal amount of blood sugar is 140 milligrams per deciliter, but diabetics have much more without medication. So why do diabetics have high blood sugar in the first place? It is because their pancreas does not produce enough insulin or their cells respond poorly to insulin. Insulin entering the cell is what allows glucose receptors to start bringing glucose out of the blood. Now I'll take you step through step of a normal insulin pathway. First, you have a semi-permeable membrane surrounding the cell. There are insulin receptors embedded in the plasma membrane. The receptors are divided into two subunits, an alpha and a beta. There is also a PIP2 molecule, which is an essential lipid in the metabolic process. When insulin molecules come from the outside of the cell and bond to the alpha subunit of the receptor. This binding causes the phosphorylation of the beta subunit in the PIP2 molecule. The IRS molecule bonds with the activated receptor and causes the two subunits of PI3 kinase to bind to the IRS molecule. Now that PI3 kinase is fully activated, it turns PIP2 and PIP3 and connects it to the membrane. The PIP3 activates the PDK1, now enters the AKT molecule, and it must go to the PDK1 molecule to get activated. PIP2 and PIP3 are phosphorylated, allowing the helping molecules to bind to the AKT molecule, activating it. We also have the GLUT4 vesicle, which needs to be brought to the membrane, but it is inhibited by the AS160 molecule. The AKT molecule postulates the AS160, causing it to be inactive. This deactivation allows the GLUT4 vesicle to move towards the membrane. The vesicle deposits the GLUT4 channels into the plasma membrane. These channels will begin taking in glucose molecules from the outside of the cell, which decreases blood sugar. There is also a GSK3 molecule that the AKT molecule inactivates, which allows glycogen synthesis to continue. The AKT activates the mTORC1 molecule, inhibiting the IRS in a negative feedback loop, and that is shown here. So what would the cell signaling pathway look like for a diabetic person? Since there is no insulin being produced by the person's pancreas, it could not even be started. This is a long and complex cell signaling pathway, but it is extremely important. Insulin production from the pancreas and insulin intake are the actions that start the whole process. So this process cannot even take place naturally for most diabetic people and must be substituted by intravenous medicine. I hope you enjoyed this video and thank you for watching.